Hi guys, my name is Hamza. I'm a fifth year medical student. Before starting out, I would like to say I'm making a set of videos regarding studying anatomy. For example, books to study anatomy, free apps to study anatomy, and how to study anatomy like this one. So I would like to say consider subscribing the channel because I believe after seeing this particular bunch of videos, you won't need any resource out there on the internet because it will be covering the whole in it, and you will be able to study anatomy effectively and score highest marks in your class without even spending a single penny. So without further ado, let's get started. When dealing with anatomy, first and foremost thing which you have to keep in your mind is you can't study anatomy from this boring 2D books. This is where the visuals come in. Anatomy without visuals is like bread without butter or room without a furniture. So where would these visuals come from? If you are a first year medical student, I have four things for you. Let's divide it into two parts. The first two things are the atlas, like themes and netters, and the other thing is the online 3D apps, like 3D bones and organs. Netters will always be a baseline for you because this is authentic. Whereas when you talk about these online 3D apps, they are sometimes faulty and would label the structure name wrongly sometimes. You can use the app for playing and having an overall visualization of how a structure looks like in the human body itself. Let's go into the detail. For example, so here you see we have these flexor carpi radialis muscle. We are in the muscles of forearm superficial layer, and we have this flexor carpi radialis muscle, this palmaris longus muscle, this flexor carpi ulnaris, and this flexor digitorum superficialis. We'll be comparing this with the other version, the app version, and we'll see the benefits of those. I have the app 3D bones and muscles. Here you can see the hand, and here you can see these four muscles again. If you click on this, the flexor carpi radialis muscle, like it's appearing on the top. Then this flexor digitorum muscle, this palmaris longus, and flexor carpi ulnaris. You can see this, and you can compare, and even you can rotate and see like the insertion points. See, so this is kind of really amazing, and it's very beneficial in learning human anatomy itself. So on the second part, there are two things, and I can't emphasize the importance of these two things as being a first year medical student. First is the Auckland's Atlas Anatomy lectures. They are free on YouTube, and if you are a first year med student, I would definitely recommend you to go through it because you have a lot of time and you can use that time efficiently to go through the Auckland's Atlas of Anatomy videos. And the other thing which was very useful for me was this Dr. Yusuf lectures. They are also free on the internet, on the YouTube, they are present. These Auckland's anatomy lectures are basically very important for those who haven't gone through cadaveric dissections, or within this pandemic you are not provided with a cadaver, or some other reason if you are a foreign exchange student and your university doesn't allows you. So definitely go through this Auckland's lecture. They are a life savior. Like there are muscles, real bones, and he teaches it very perfectly. Whereas the Dr. Yusuf lectures, those are really important in exam point of view, and the main things what you want to know from any topic like upper limb, lower limb, abdomen. He has good quantity of lectures, and it basically covers it all, the important and all the useful information for exam and for your understanding. One more thing, if you are in second or third year dealing with physiology and you are thinking about superior vena cava, inferior vena cava, bringing the blood into right atrium, then from right atrium into right ventricle, from right ventricle into pulmonary arteries, and pulmonary arteries take them to the lungs, make them oxygenated, and bring back into the left atrium, from left atrium into left ventricle, and then into aorta and systemic circulation. Or if you are dealing with pharmacology, and in pharma you are dealing with beta 1 receptors, they are present on the heart, SA node, AV node, and atrial and ventricular myocardium. So you need a particular image to imagine for that. So for that thing you can basically go into the lectures like Anatomy Zone on the YouTube. They are for free. They are short images, short videos. You can basically see them all, and you can have a very good revision kind of a concept with those 8 or 9 or 2 to 3 minutes videos. And the other thing I would recommend is CanHub. The CanHub also has short videos there, sometimes 1 minute, 2 minute, 3 minutes. So these are basically if you're stuck somewhere and you want an image to see it how it happens, so you can definitely go into these sites and watch these small videos. Whereas for the first year I would recommend the Auckland's, and other thing is that Dr. Yusuf lectures, and those are the most important. For these if you're a second year, third year, or if you're in fifth year, you just want to imagine, you can definitely go for Anatomy Zone and the Scan Hub. I can't stress the importance of repetition. It's not gonna be like this, you have studied one day and the other day you wake up, you just memorize all of the anatomy. It's never going to happen that way. So, anatomy itself, is a new language. You have to eat, sleep, walk, do everything within this language, within this environment. And until you don't make yourself comfortable with this, there's no way you are gonna like this subject till your first year ends. And you'll need the subject everywhere, even in internal medicine. Whereas in surgery, in any residency, you need something to imagine. So the importance of repetition itself is very important. For repetition, you can use Quizlet, you can use flashcards. Quizlet is actually an app in which we make flashcards. And there are other techniques about this particular thing we'll be discussing in detail in the next video. So consider subscribing the channel and press that bell notification so you'll receive the notification as soon as I post the next video. So the main thing is repetition is the key to success in anatomy. Third thing is, mnemonics. The thing about mnemonics is the more dirtier they are, the more they will stick into your mind. So I would prefer that you make this mnemonics in your own mother tongue. For the sake of example, I'll just put one like, she looks too pretty, try to catch her, for carpal bones. So she means scaphoid, looks lunate, too triquetral, pretty pisiform, try trapezium, to trapezoid, catch, capitate, her hamate. This is just a single example. You can make your own mnemonics, as well as you can take from the internet, like from the Google you'll find many, and in the personal different groups on Facebook or different places you can get them a lot. So but I would suggest you make it your personal, because they are gonna stick with you until you die, like literally. So mnemonics are really important. Fourth thing is, the clinical significance, like what a structure is supplying, where the structure is supplying, or where its origin insertion is, or like what will happen if this structure will damage. So like we'll take an example of carpal tunnel syndrome. In the carpal tunnel syndrome, the median nerve is damaged. So where does the median nerve supplies? The median nerve supplies the palmar side, this side, palmar side of the thumb, the palmar side of the index finger, the middle finger, and half of the ring finger. So these places won't be working properly. So if you'll try to remember with some kind of clinical significance, it would be very easy to remember the structures itself. So this is a single example. You can use it in multiple places in your own way. Last thing we'll talk about is cadaver. I can't emphasize the importance of actively participating in the cadaver, in the practical lab. Don't be shy and just study with friends actively. The study which you are doing in the cadaver lab itself, you are gonna retain the most. And in case of anatomy, when you're studying with friends, many people have very good memories in the cadaver lab itself, because they are actively learning as well as enjoying their journey in that place itself. So it's very important to learn everything, see every structure itself in the cadaver, and learn it at that time. This will definitely stick to your memory. And the other thing is, if you don't have the cadaver, somehow you don't have the cadaver, etc., circumstances, so you can go for Auckland's anatomy lectures. It's not less than a cadaver, so you can definitely enjoy that free online resource out there on YouTube. With this, I'll take your leave. The series of videos I'll be posting, each video every Friday or once in a week. I'll be posting 4 to 5 videos regarding this anatomy thing. So consider subscribing the channel, press the bell icon so you can receive the notification first, and you can take benefit of the videos on the YouTube. So I'll see you in the next video. Until then, see ya.